We all get stomach aches. Sometimes it's the food, sometimes it's stress, sometimes it's just part of life. But what if that discomfort wasn't so innocent? What if your body was trying to tell you something deeper, something growing quietly beneath the surface? That's the reality of stomach cancer, also known as gastric cancer, one of the most overlooked and underestimated cancers today. Because here's the truth, stomach cancer often starts with subtle, everyday symptoms: indigestion, a little bloating, a loss of appetite, feelings that come and go and feel easy to ignore. And that's the danger. By the time most people take those symptoms seriously, the cancer has already spread to the lymph nodes, to the liver, to other parts of the body where treatment becomes more difficult and survival rates drop sharply. But it doesn't have to be this way. When detected early, stomach cancer is treatable, and in many cases, it's curable. The key is knowing what to look for before it gets worse. In this video, we'll help you understand why stomach cancer is so often missed, recognize the early symptoms that people mistake for common problems, learn what risk factors matter most, and take simple, proactive steps to protect yourself and your loved ones. Because stomach cancer doesn't always come with loud warning signs. It often whispers first. But if you're listening, if you know what to watch for, you can catch it early. And early action saves lives. Let's talk about why stomach cancer is more common than you think and what you can do starting today to stay ahead of it. Stomach cancer is one of the leading causes of cancer death worldwide, not because it spreads faster than other cancers, but because it's usually found too late. Why? Because the early symptoms are so common. A little bloating after meals, some nausea, feeling full too quickly, even mild indigestion. These signs don't set off alarms. They feel normal until they're not. By the time the cancer grows large enough to cause real pain, vomiting, or noticeable weight loss, it has often spread beyond the stomach. At that point, treatment becomes harder. Surgery may be more complex. Chemotherapy and radiation may be needed, and survival rates drop significantly. But here's the good news. If caught early, stomach cancer can be treated effectively and sometimes cured. In early stages, small tumors can be removed through minimally invasive surgery. The stomach can function normally afterward. Recovery is faster, outcomes are better, and life goes on. The problem is that early detection requires awareness. It means not ignoring symptoms just because they seem mild. It means understanding your risk factors. And it means talking to your doctor, not waiting until you can't eat, can't hold down food, or can't get out of bed. So, who's most at risk? People with a family history of gastric cancer, Helicobacter pylori, age, pylori infection, chronic gastritis or ulcers, diets high in salted, smoked, or preserved foods, long-term smoking or alcohol use, a history of stomach surgery, being over age 50, especially in men. These individuals should pay even closer attention to stomach-related changes. And if you're in one of these groups, routine screening may save your life. Doctors can perform simple diagnostic tests, endoscopy, biopsies, imaging like CT scans, blood tests for tumor markers. None of these are dangerous, but they only happen if you ask. Don't let the quiet nature of stomach cancer give you a false sense of security. Just because it doesn't hurt, doesn't mean it isn't growing. In the next section, we'll go through the specific early signs of stomach cancer, from changes in appetite to the way your body feels after you eat, so you can stay ahead of a disease that tries to stay hidden. Let's listen to what your gut may already be trying to say. Stomach cancer doesn't usually begin with extreme symptoms. It begins with small, subtle changes, ones you might chalk up to poor diet, stress, or getting older. But those early signs can make all the difference if you pay attention. Let's walk through the most common early warning signs of stomach cancer. These symptoms may seem harmless at first, but when they persist or appear together, they become cause for concern. 1. Persistent indigestion or heartburn. A little acid reflux after spicy food is normal, but if you're experiencing constant indigestion, even with simple meals, and it doesn't improve with over-the-counter medicine, that's a red flag, especially if it's accompanied by bloating or pain in the upper abdomen. 2. Feeling full after eating very little. Early satiety. This symptom often goes unnoticed. You start eating, and just a few bites and you feel stuffed. If this happens regularly, it could mean a tumor is affecting the stomach's capacity or slowing digestion. Don't ignore it, your stomach is trying to tell you something. 3. Loss of appetite. Food that used to excite you now turns you off, or you find yourself skipping meals without meaning to. Your body may be signaling internal inflammation or early-stage cancer. This symptom is especially concerning when it comes on suddenly and lasts for weeks. 4. Nausea or vomiting, especially after meals. Occasional nausea can come from many sources, but persistent or recurring nausea after eating may point to an obstruction or irritation in the stomach lining. In some cases, vomiting may occur, and if blood appears in vomit, seek immediate medical attention. 5. Unexplained weight loss. If you're losing weight without trying, especially alongside appetite changes or digestive symptoms, it's time to investigate. Your body may be struggling to absorb nutrients, or your metabolism may be affected by the tumor's presence. Weight loss without a clear reason is always a warning sign. 6. Stomach pain or discomfort. This isn't the sharp pain of food poisoning. It's often a dull ache or pressure in the upper, middle, or left side of the abdomen. It may feel worse after eating, or come and go over time. Many people dismiss it as gastritis or gas, but persistent discomfort deserves a closer look. 7. Bloating, especially after meals. Feeling excessively bloated after eating, even light meals, may point to impaired stomach function. If your belly swells regularly after eating, even if you're eating small amounts, it's time to check your digestion deeper. 8. Black or tarry stools. This may indicate bleeding in the stomach, especially if paired with fatigue or weakness. When blood is partially digested, it turns stool black and sticky in texture. This isn't from food or supplements. This is your body sounding an alarm. 9. Blood and vomit. Vomit that looks like coffee grounds or contains bright red blood is a sign of internal bleeding in the upper GI tract. This can result from ulcers, but also from tumors, so it should never be ignored. Seek immediate medical care. 10. Fatigue and weakness. Not just sleepiness, but a deep physical fatigue that doesn't improve with rest. This can result from chronic blood loss, poor nutrient absorption, or cancer-related inflammation. If you feel unusually run down day after day, it may be your body fighting more than just tiredness. When to act. Most of these symptoms can come from other, less serious issues. But here's the rule. If they persist for more than 2 to 3 weeks, or appear together, talk to your doctor. If you have a family history of stomach cancer, ulcers, H. pylori infection, or are over 50, don't wait. You may need screening. Doctors can perform endoscopy, biopsies, imaging scans, blood tests. None of these are complicated, but they only happen when you take the first step. In the next section, we'll talk about exactly what to do if you notice any of these symptoms and how to take action with calm, clear steps. Because when it comes to stomach cancer, hesitation is the real danger, not the diagnosis. So maybe you've noticed something. You're eating less. Your stomach feels strange after every meal. You've lost a few pounds without trying, or that gnawing ache in your belly just won't go away. It's easy to feel anxious. Your mind races. Is it just stress? Is this something serious? Should I ignore it or check it out? Here's your answer. Don't panic, but don't ignore it either, because when it comes to stomach cancer, early action is your best protection. Step 1. Don't self-diagnose online. We all search symptoms, but online information isn't personalized. Your body is unique. The only way to know for sure is to see a real doctor. Reading articles can help you stay informed, but they can't replace a physical exam or proper tests. Step 2. Track your symptoms. Write down what you're feeling, when it started, how often it happens, what makes it worse or better. Even simple notes help your doctor make better decisions faster. Step 3. Make an appointment. Start with your primary care physician. If they find anything concerning, they may refer you to a gastroenterologist, a specialist in digestive system health. When you speak to your doctor, you don't have to sound perfect. Just be honest. I've been having persistent indigestion and feel full really quickly. It's been going on for a few weeks, and I'm a little worried. That's enough. That one sentence opens the door to early detection. Step 4. Expect simple, clear testing depending on your symptoms and risk level. Your doctor may recommend a blood test to check for anemia or tumor markers, an upper endoscopy, a thin tube with a camera that looks inside your stomach, a CT scan or ultrasound, a biopsy, if something suspicious is found. Most of these are non-invasive or minimally invasive and often done in outpatient clinics. Step 5. Take action based on what you learn. If everything looks normal, great. You've ruled out something serious and you've gained peace of mind. If something is found early, even better. You'll have more treatment options, less aggressive care, and a higher chance of full recovery. That's the power of action. You stay in control. Bonus: no. When screening is recommended if you have a family history of gastric cancer, long-term H. pylori infection, chronic gastritis or ulcers, a diet high in salted or smoked foods, you're over age 50 and experience persistent symptoms, you may qualify for routine screening even without obvious symptoms. The most dangerous thing about stomach cancer isn't the diagnosis, it's the delay, the missed signs, the "I'll wait and see." So don't wait, don't worry in silence, don't assume it'll go away. Speak up, get checked, and give yourself the chance to act early while it still matters most. In the next section, we'll bring it all together, because your health, your future, and your peace of mind are worth far more than a little discomfort or delay. Your stomach does so much for you. It nourishes you. It fuels your energy. It supports your immune system. It works in silence, meal after meal, day after day until something goes wrong. And when something does go wrong, your body rarely screams. It whispers. A little nausea, some loss of appetite, a feeling of pressure, things you think will go away, but sometimes they don't, and in those moments, what you do next matters more than anything else, because the difference between a stomachache and stomach cancer is how soon you act. It's not about being perfect. It's not about being fearless. It's about being aware. You have the power to protect your health. You have the power to speak up. You have the power to say, this doesn't feel right and I deserve to know why. So many people wait. They wait for the pain to get worse. They wait until they lose weight. They wait until eating becomes a chore. And sometimes, they wait too long. But that doesn't have to be your story. Because you've watched this video. You've learned the signs. You've taken the first step. Now it's time to take the next one. Listen to your body. Trust your instincts. Talk to a doctor even if you're unsure. Because early detection changes everything. It changes fear into action. It changes illness into recovery. It changes a threat into a manageable moment. You deserve that chance. Your family deserves it. Your future depends on it. So take control. Be the person who doesn't wait. Be the person who chooses to act before it's too late. Because your life isn't worth gambling with. It's worth protecting. And it starts with something as simple as paying attention to yourself. In the final part of this video, we'll give you one last push to take action, not just for you, but for everyone who loves and depends on you. If this video made you stop and think about that discomfort you've been ignoring, about your appetite, about your weight, about your health, then don't let this just be a video. Let this be your turning point. Share this video with someone you love, your parents, your siblings, your best friend, because stomach cancer doesn't care who you are, and awareness spreads faster than any disease. Take one small step today. Book that appointment. Ask that question. Write down your symptoms. Don't put it off, not this time. Leave a comment below. Have you ever ignored these symptoms? Do you know someone who's battled stomach cancer? Your voice could be the spark that inspires someone else to act. Subscribe to our channel for more videos like this, each one designed to make health feel less confusing and more empowering. And if this video helped you, hit the like button so the algorithm sends it to more people who need it. In our next episode, we'll look at esophageal cancer, type often mistaken for acid reflux, and how to spot it before it's too late. So click the notification bell and stay ahead of what's next. Most importantly, listen to your gut, literally, because sometimes it's not just what you eat, it's what your body is trying to tell you. Don't wait for pain. Don't wait for fear. Act early. Stay informed. And as always, take care of yourself and those you love.